setting up protocols, supervising the laboratory every single day of their lives, 24/7. They're responsible for 2 hospitals, and they're owed over $1 million, and they've got nothing. And this defendant says that's right. That's the way it should be. We don't have to pay them. We get to keep the money. They're sitting there right now with the doctor's money. Not right. I submit the evidence proves this is not right. So what happens? Let's look at this little step by step. We have subscriber people. They have an HMO policy with Blue Cross Blue Shield. They need to go to a contracted hospital. That's Palmetto, Coral Gables Hospital, contracted hospital. They have a contract with the defendant. They go in because it's an approved hospital. And if they need pathology services, the pathologists that they're going to get are Dr. Abel's group, Dr. Ray's group, Dr. Lancet's group, Dr. Isaac. They're all the 4 of them. They're the ones that they get. They do all the pathology services. They're responsible completely for the labs. So when they need testing, any type of lab work, Dr. Abel's group is the one that does it, Palmetto Pathology. And we heard from Dr. Havner, who, by the way, was on the Board of Governors of the American College of Pathologists, who certifies the laboratories in the United States of America. It's the highest standard. He's a professor of medicine, clinical medicine, for Baylor and another university medical school in Texas. He has served as president of the Texas Pathology Association and written a bunch of articles and testified as an expert in pathology throughout the country, not in economics, pathology. And what does he say? Professional component of clinical pathology is critical. It is a cornerstone. It is the foundation of quality medical care. If you do not pay fairly for it, the whole system will crumble. People will die. That's what he told us. A doctor. And we asked him, did you review the rate sheets for Dr. Abel's group on the professional component of clinical pathology? Yeah, I reviewed them. What did you think? They were reasonable, they were usual, and they were customary for the types of services that they're providing. The rates were right. The rates were correct. Well, what are they for? What is professional component of clinical pathology? Well, it includes to make sure tests, examinations, and procedures are properly performed, reported, speaking with the medical staff about laboratory operations, quality, and test availability, making rules for performance of clinical testing, recommending appropriate follow-up diagnostic tests when needed, supervising laboratory technicians and letting them know of errors in the test results, selecting, evaluating, and validating test procedures, overseeing quality and control procedures, evaluating clinical laboratory data, and establishing a process for review of test results before the report is done, to make sure the hospital complies with all state laws, Medicare conditions, healthcare organizations, pathologist laboratory accreditation program, and federal certification standards. That's what it is. And for every vial of blood and for every urine sample, these doctors' names go on it, and they're responsible for every single one. They are assuring that those results are accurate. They are assuring quality control standards. They are assuring that the reports are correct and timely made. That if coordination with other doctors is needed, it will be done, and done correctly. That if any equipment is off, it will be fixed. That if any laboratory employee is not doing what he or she should be doing, that they are immediately corrected. They're responsible, they're the captains of the ship. The buck stops there. Professional component of clinical pathology. And the defendants say, hey, it has no value. We don't need it. Insurance companies should keep the money. We send the bill. The work is done. It goes to the billing company. Remember the 26 modifier, which is the professional component? There's 2 components, by the way. The defendants are going to tell you, oh, we pay the hospitals. What they pay the hospital is the technical component. which is the equipment itself and the staff people at the hospital. That's called the technical component. They don't pay the professional component. And you'll see no document that says they're paying the professional component. It doesn't exist. So they're going to say, we pay the hospital. What they pay the hospital is the technical component. For the hospital's portion of it. Remember when you heard Ms. Busky, she said we work in coordination, but the doctor is the captain of the ship. We rely on what the doctor says and what the doctor does on everything. So what they pay is the technical component. The professional component is what professional, the medical doctor, medical diagnosis, medical judgment. Only a doctor can do that. Only a doctor can do that. So that's where the professional component comes in. And it's referred to under the CPT codes, which you heard about, the current procedural terminology. That's the 26 modifier for the professional component of clinical pathology. So those services are billed at the usual, customary, reasonable, and necessary rates. As Dr. Abels testified, as Dr. Hausner testified, based on what's fair for those services. And then it goes where? To the defendant. To the defendant. And the defendant says, we're not going to pay that part of it. And then they send out those Hicks forms that was kind of like an appeal process. You know, please pay us. Come on, please pay us. No. We're not going to pay. They didn't say, and this is very important, ask yourselves, why didn't they say from 1999 to the present, why didn't they say, your rates are unreasonable. We think you're charging too much. Lower it. Let's negotiate the amount. They didn't say that. You're not going to see any documentation about that. It's not the amount of the bill. They just didn't want to pay it at all. Nobody, you didn't even hear any testimony. Did the defendant bring in here an accountant or somebody to say, those rates,
5 minutes.
I'm going to go a little longer. Those rates are unreasonable? Did you hear that? Did you hear him say those you overbilled? Or you billed improperly? Now, they brought out one HICFA form and said, oh, look at that. It looks like 6 procedures out of one blood file. Out of 10,000 entries with multiple services provided in each one. Over 10,000, thousands and thousands and thousands of entries that whip out one HICFA form, maybe 2, that they think they have a problem with. And it's not like they saw it for the first time, folks. These things were given to the defendant since the beginning of time, before a lawsuit was ever even dreamed of. This lawsuit was filed in 2005. They've been getting the billing and the appeal forms for this case since 2001. Not once did they say, you're asking for too much money. They just said, we don't want to pay you. Because you're going to get paid. Remember that? You're going to get paid twice. Come on. You think we'd be here if we got paid once? So what happens? The doctor's bill, Health Options Inc., for the professional component of clinical pathology. Health Options refuses to pay. You know why? Because it's nice to keep $4.1 million in the pockets of Blue Cross Blue Shield. The evidence is undisputed. CPT terminology. This is from the CPT code book. The American Medical Association brings it out. They are responsible for CPT codes. They are the guardians of the CPT code. They write the CPT code. There is a member of Blue Cross Blue Shield Association, Dr. Adamson, who sat on the executive committee of the editorial panel of the CPT code. What do they say? You got to pay for the professional component of clinical pathology. Remember when we asked them, hey, you know what? And Blue Cross Blue Shield Association, remember Mr. Conway said it's our governing association? And what he said there? That's what he said. And then I asked the expert, oh, you know Dr. Adamson, huh? Yeah. You ever ask him what he thinks about it? Nope. Very interesting. Why not ask the guy that sits on Blue Cross Blue Shield Association, the medical doctor, who recommended payment of professional component of clinical pathology,